The skeletal system, the anatomy. The skeleton itself gives you the form that your body takes on. So if we have a bone that's broken, it's going to change form. So the ligaments, tendons, and cartilage are all pieces that help keep everything together. So the ligaments connect the bone to bone, the tendons connect muscle to bone, and then our cartilage is that cushion between the bones. So we definitely want to keep that in place for as long as we can. Our axial skeleton, it forms the foundation in which our arms and legs are attached. The axial skeleton is composed of our skull, our facial bones, thoracic cage, and vertebral column. The arms and legs, their connection points, and the pelvis make up your appendicular skeleton. The brain lies within your skull. So our heart, lungs, and great vessels are enclosed in our thorax here in our chest. As we get into our skull itself, we're looking at the cranium. So it's composed of a number of thick bones that fuse together to form the shell above the eyes and ears that hold and protects our brain. The brain connects to the spinal cord through a large opening at the base of the skull called the foramen magnum. That becomes huge in our head injuries. We have to remember that part right there, that foramen magnum. And in Latin, that means a great opening. Your four major bones make up your cranium. The most posterior portion of the cranium is the occiput. So we call this the occipital area. Then you have your temporal bones, parietal bones, frontal bone. When you're giving the description of where somebody has hit their head, we'll tell them they hit the occipital portion or the frontal portion and they have a hematoma or a laceration or whatever it is they have going on. But that lets the hospital know where, and then that lets them go a little bit further of saying, okay, well, this vessel could be ruptured, this part of the brain can be affected. Our face is composed of 14 bones. Our maxilla, or our cheekbones, our jawbone is the maxilla. Our cheekbones is the zygomas. The mandible is the lower movable portion of our jaw, and the orbit, or our eye socket. The spinal column, so our vertebrae, they're named according to the section. So our cervical spine, and there are 7 cervical. Our thoracic spine, and there are 12 thoracic. Our lumbar, and there's 5 lumbar. And then the sacrum and coccyx, and both of those are fused. So if you're ever palpating below the lumbar area and you feel that it's not together, that's a significant finding. So the thorax, or our chest, it's going to contain our hearts, our lungs, our esophagus, our great vessels. That includes our aorta and then our 2 vena cava. So with our thorax, we have our sternum, which is this center part, pretty solid. It's where we go to when we do our chest compressions. The upper section of the sternum is called the manubrium, and the body comprises the rest of the sternum except for a narrow cartilaginous tip inferiorly down here that is called your xiphoid process, and that's very important when we start talking about respiration and breathing. Our joints, So wherever bones come in contact, a joint or articulation is formed. The joint consists of the ends of the bones that make up the joint and the surrounding connecting and supporting tissue. Most of those joints are named by combining names of the body and the bones to form that joint. So for example, the sternoclavicular joint is an articulation between the sternum and the clavicle. So it's going to allow for that motion. The bone ends of a joint are held together by a fibrous sac called the joint capsule. Your sacroiliac joint is virtually surrounded by tough, thick ligaments. They'll have a little motion, whereas a joint such as the shoulder will have few ligaments. Will be free to move in almost any direction. You have articular cartilage, which is in that moving joint. The ends of the bones are covered with that thin layer of cartilage, and that is your articular cartilage. The synovial membrane is that inner lining of a joint capsule, and then the synovial fluid is that lubricant. So it's that special tissue that is responsible for making that thick lubricant. We have our ball and socket joints, we have our hinge joints, and then ultimately our motion is either our flexion or bending, or our extension, which is our straightening. So our shoulder girdle, clavicle, scapula, all part of our upper part. Then we have our in our arm we have our humerus, and then we have our radius and our ulna. With our wrist, we have our carpal bones, our metacarpals, and our phalanges. In our pelvis, we have our ilium, ischium, pubis, and then our pubis symphysis. Ultimately, the part of the pelvis where the leg connects to the hip joint is our acetabulum, and it's formed where the ilium, ischium, and pubic bones meet. So this is a lot of times where our patients will end up with a hip fracture. That's where it's fractured. So it can be other locations depending on just how they fracture it or how they've fallen. But in the lower extremities, we have our femur, which is our largest bone in the body, that thigh bone. It's very hard, just like the humerus, it's very hard to break. So if you fracture a femur, you need to pay attention, because something significant has caused that patient to break that bone. At the superior end of the bone is that round structure called the femoral head. So back to where we were talking about, if they have hip fractures in that articulation up there at the acetabulum, a lot of times it may affect that femoral head as well. Then the projection of the lateral and superior portion of the junction between the femoral neck and the shaft is the greater trochanter, and then the projection of the medial and inferior portion of the junction between the femoral neck and shaft is the lesser trochanter. Both projections are anchor points where the major muscles of the thigh connect to the femur. And that is part of the reason it's so painful, because that muscle contracts once it is basically ripped if they have a fracture. So we try to manage that pain, and we try to get them in positions of comfort as much as we can. Then our patella, that kneecap, our tibia, our shin bone, our fibula, the smaller bone on the opposite side. And then our ankles, we have our tarsals, metatarsals, and then our phalanges and our toes.